Dr. Shoshana Ungerleider is joining us now from San Francisco with more on this. So, doctor, the CDC has updated its guidance on face masks. It now says that they also help to protect the person wearing them, and also gave us some sort of more specific guidelines about like what a good face mask is and what isn't a good face mask. So, what do you make of these changes?
Well, Anne Marie, the report indicates that based on their review of evidence, cloth masks not only block viral particles exhaled by the person wearing the mask, but also provide a filtration by blocking incoming infectious droplets from other people. So, that's something that is important that they are coming out with in terms of evidence. And I think it's also important to note that the report states that mask wearing reduces the risk of transmitting or catching the virus by more than 70%. That's 70 in various instances. So the one thing that really stood out to me as being the most interesting is that increasing universal masking by 15%, so just increasing it by 15% alone, could prevent the need for lockdowns and reduce economic losses of up to $1 trillion. So, to me, the bottom line here is that there is no question that masks work and we should all be wearing them. It's important to wear a mask that fits your face tightly. The thicker, the better, and make sure that it's comfortable so you can continue wearing it throughout the day.
Doctor, as you know, in some cities, people could face civil fines if they're caught not wearing a mask. This is sort of a policy question, not really a medical one, but, I wonder what you think would be the best way to encourage people to wear a mask. I mean, it just strikes me as strange that people see the wearing of the mask as something that impedes their personal liberty. And I think this sort of inward-looking attitude that people have, as opposed to thinking about it in terms of protecting the people around you, in terms of protecting vulnerable people around you, in terms of protecting your neighbor, those that you interact with, whether it's the bus driver or the mailman or somebody that you're buying groceries from, is a better way to think about it. And if we all had sort of a more collective understanding that we're all in this together, then it wouldn't seem so much as if we're asking you to do something that impedes on your personal liberty.
I mean, I couldn't agree with you more, Vlad. I think that's a perfect way to put it. I do believe that enacting mask mandates and creating some kind of accountability in various locales is very important, something the Biden administration has agreed to enact immediately. I think a lack of solid, concise public health messaging coming out of the current administration has put us in this situation where wearing a mask is highly politicized and not seen as the act of love or care that it is in protecting other people and those that you love from becoming sick.
Yeah, and I know, I think also part of it a little bit, doctor, is because I don't want to say it, because there are many people out there that are caring and care about their neighbors and all that sort of thing, and still are prone to not wearing a mask. And some of it has to do with just your exposure to the virus. That for some people, if you just don't know anyone who's ever contracted it, then it's hard to believe that it is such a widespread problem. For those people living in New York, you got an up-close look at the impact of this virus very early on. For a lot of those people sort of in the Midwest or in the middle of the country, it's only now that they're seeing what New York had suffered through many months ago. And, perhaps that, hopefully that's waking people up. It's unfortunate, though, because it's going to be too late for many, many people. But I think also what sort of adds to this, doctor, is sometimes there is confusion about some of the restrictions and policies put in place. And this is one of them. So New York City isn't the only place that is doing this. New York City has imposed curfews on spaces like gyms and restaurants. And so that means that, they have to close by 10 o'clock. And I've seen people on social media say, what happens, at 10 o'clock, suddenly the virus wakes up? What happened at 9:59? There's no virus inside the gym? I think people don't really understand I think some of these restrictions seem arbitrary to people. So just focusing in on early closing, how does that help?
Well, Anne-Marie, by reducing the number of people who are congregating indoors, talking and eating, or in the case of a gym, breathing hard as you do when you exercise, this limits the spread of the virus, right? So remember that the highest risk spaces are indoors with poor ventilation and where people are next to one another, not wearing masks. So it's less about the time of day and more about reducing the number of people who are engaging in higher risk behaviors. And frankly, this is a necessary step in order to limit really these high risk locations for the spread of the virus.
Dr. Ungerleider, speaking of locking down restaurants and gyms, I sort of, and again, I'm not a public policy expert, I'm not a doctor, but it strikes me as problematic that in the case of New York City, that restaurants were allowed to open in the way that they have opened. I think everybody was for being able to go to the restaurant and pick up some takeout food and take it back with you home, but now allowing people to dine indoors, having gyms open up in the city, and now they potentially may have to close even, I'm sure as this gets worse, there will be more measures put into place. And now public schools in New York City may have to close as well because of that. I mean, that's something sort of a logical end game here as as people in the city become more infected or as these cases surge. I mean, would you have advised the governor or the mayor to open up gyms, for example?
Well, Vlad, I'm not a policy expert, but I can speak from my medical experience. And just like at the beginning of the pandemic, when our federal officials issued guidelines for reopening based on community spread of the coronavirus, there were specific recommendations for when to roll them back in order to curb the spread. Now, the majority of places did not follow those recommendations. And I think that's what has led us to where we are now. In many places, we are at that point, right? So especially in this moment, when the current federal administration is paying really no attention to this very serious public health crisis that we're in, states have to act as New York and New Jersey are, and many others, and unfortunately increase restrictions, enact mask mandates, and do everything they can right now to stop the spread of this virus.
Dr. Shoshana Ungerleider, thank you so much.
Thank you.